Ever woken up with a headache, facial pain, and nasal congestion? Could it be sinusitis or a common sinus infection? Welcome to the world of sinus health, where these symptoms are all too familiar. Sinusitis, a condition that causes inflammation in the sinuses, is incredibly common, affecting millions of people around the globe. Inflamed sinuses can lead to a range of uncomfortable symptoms. Maybe you've experienced them yourself. The throbbing headache that seems to radiate from deep within your skull, the facial pain that intensifies when you lean forward, or the relentless nasal congestion that makes it difficult to breathe. Sinusitis is just one piece of the puzzle. Some of you might be dealing with a sinus infection, a condition that shares many symptoms with sinusitis, but requires a different treatment approach. Whether you have sinusitis or a sinus infection can make a world of difference in your approach to treatment. So what's the difference between sinusitis and a sinus infection? They might sound similar, but they're not the same. In the simplest terms, sinusitis is inflammation of the sinuses, while a sinus infection, also known as sinusitis, is a condition where the sinuses become infected. Yes, it can be a little confusing, but don't worry, we'll break it down. With sinusitis, the tissues lining your sinuses become inflamed and swollen. This can be caused by various factors, such as allergies, cold, or other respiratory illnesses. Common symptoms include a runny or stuffy nose, facial pain or pressure, and reduced sense of smell. You might also experience a cough, especially at night, and feel generally unwell. On the other hand, a sinus infection takes things a step further. It usually begins with inflammation, as in sinusitis, but then bacteria or viruses get involved, causing an infection. This typically happens when the inflammation blocks the nasal passages, providing a perfect breeding ground for germs. A sinus infection often comes with similar symptoms to sinusitis, but they might be more severe and last longer. You might also have a fever, bad breath, and a thick yellow-green nasal discharge. How can you tell the difference? It's all about duration and severity. If your symptoms are mild and last less than a week, it's likely sinusitis. If they're severe, persist for more than a week, and are accompanied by a fever, you might be dealing with a sinus infection. So why does it matter? Because the treatment for each condition differs. Sinusitis, especially when caused by allergies, often responds well to over-the-counter treatments and home remedies. A sinus infection, however, might require antibiotics or other prescription medications. While both conditions can cause discomfort, understanding their differences can help you find the right treatment. Understanding these differences and responding appropriately not only helps you feel better sooner, but also prevents complications and promotes overall health. Now that we know the differences between sinusitis and a sinus infection, let's delve into what causes these conditions. Sinusitis and sinus infections can be triggered by a variety of factors, but they all have one thing in common. They cause inflammation and swelling in the sinuses. This inflammation can block the normal flow of mucus, leading to an accumulation that can become a breeding ground for germs, causing an infection. Let's start with allergies. The body's reaction to allergens like dust, pollen, or pet dander can cause the nasal tissues to swell, leading to sinusitis. This inflammation can block the sinuses, making them a perfect environment for bacteria to thrive and potentially leading to a sinus infection. Next up, colds and viral infections. These can also lead to sinusitis, as the body's immune response to a virus can cause the nasal tissues to swell and block the sinuses. And while a viral infection can't be treated with antibiotics, it can set the stage for a secondary bacterial infection, which can lead to sinusitis or a sinus infection. Then there's the bacterial factor. Sometimes bacteria can enter the sinuses and cause an infection directly. This is often the case with sinusitis that persists for more than a week or two, despite treatment. Lastly, there are other factors like nasal polyps, deviated septum, or immune system-related diseases that can also lead to sinusitis and sinus infections. These conditions can cause chronic inflammation and blockage of the sinuses, making them prone to infection. It's important to note that while these are common causes, everyone is different. What triggers sinusitis or a sinus infection in one person may not have the same effect in another. That's why it's crucial to work with a healthcare provider to understand your triggers and manage your symptoms effectively. Knowing what triggers your symptoms can be the first step to managing and preventing sinusitis and sinus infections. So you've got sinusitis or a sinus infection. What can you do about it? One of the first ports of call when dealing with sinusitis or sinus infection is over-the-counter medication. A myriad of options exist, from decongestants that help to reduce inflammation and mucus production to pain relievers that can alleviate discomfort. Nasal sprays can also offer a respite, helping to soothe and moisturize your nasal passages. Now let's talk about some home remedies. You've probably heard about the magic of steam inhalation. By simply inhaling the steam from a hot shower or a bowl of boiling water, you can help to loosen the mucus and soothe your sinuses. It's like giving your sinuses a warm, comforting hug. Another age-old remedy is the use of a warm compress. Applying a warm, damp cloth to your face can help to ease pain in your sinuses and reduce inflammation. As simple as it sounds, it can work wonders. Hydration is another key player in the sinusitis and sinus infection game. Drinking plenty of fluids helps to thin out mucus, making it easier for your body to drain it. So keep that water bottle close and make sure you're sipping away throughout the day. Rest, my friends, is not to be underestimated. When your body is under attack, it needs all the energy it can get to fight back. So listen to your body and get that much-needed sleep. But what if these remedies just aren't cutting it? When should you see a doctor? If your symptoms persist for more than a week, or if they get worse, it might be time to seek medical advice. High fever, severe headaches, and vision problems are also signs that you should get in touch with a healthcare professional. Remember, your health is paramount. Don't ignore persistent or severe symptoms. With the right approach, you can effectively manage your symptoms and get back to feeling your best. Apart from remedies at home and the over-the-counter medications we've discussed, let's delve into the role of traditional and alternative medicine in treating sinusitis and sinus infections. Traditional medicine often involves antibiotics prescribed by a healthcare professional. These are particularly effective if your sinusitis is caused by a bacterial infection. However, it's crucial to remember that antibiotics should only be used when necessary, as misuse can lead to antibiotic resistance. Steroids are another common medication that may be prescribed to reduce inflammation and swelling in your sinuses. In severe cases, surgery might be considered to clear the sinus passages. Now, let's talk about alternative medicine. Acupuncture, a traditional Chinese medicine practice, has been reported to help with sinusitis symptoms by improving sinus drainage. Herbal remedies such as echinacea and golden seal are often used to boost the immune system and fight off infections. Essential oils like eucalyptus and peppermint can also offer relief through aromatherapy by reducing and promoting relaxation. Remember, while these treatments can be beneficial, it's important to consult with a healthcare professional before starting any new treatment regimen. Sinusitis and sinus infection can take a toll on your mental and emotional well-being. Chronic pain and discomfort associated with these conditions can lead to frustration, anxiety, and even depression. The constant pressure in your head, the inability to breathe properly, and the overall discomfort can drastically affect your mood and daily functioning. It can lead to sleep disturbances, which can further mental health issues. Moreover, dealing with persistent symptoms can be emotionally draining. The constant cycle of feeling unwell, seeking treatment, experiencing temporary relief, and then having symptoms return can lead to feelings of hopelessness and despair. The stress of managing a chronic condition, along with the disruption it can cause in your personal, professional life, can take a significant emotional toll. This is why it's crucial to not overlook the importance of mental health care in managing sinusitis and sinus infection. Seeking help from a mental health professional can provide you with strategies to cope with the emotional stress of dealing with these conditions. Mindfulness techniques, stress management strategies, and cognitive behavioral therapy can all be part of a comprehensive treatment plan for sinusitis and sinus infection. Taking care of your mental and emotional health is just as important as treating the physical symptoms of sinusitis and sinus infection. Remember, you're not alone in this journey, and there are resources available to help you cope. Let's take a moment to summarize what we've learned about managing sinusitis and sinus infection. Home remedies such as steam inhalation, applying a warm compress, and staying hydrated can provide temporary relief. Over-the-counter medications, antibiotics, and steroids are common treatment options, while surgery may be considered in severe cases. Alternative medicine options such as acupuncture, herbal remedies, and essential oils can also be beneficial. However, it's important to consult with a healthcare provider before trying these. A balanced diet, regular exercise, adequate sleep, and stress management all key to boosting your immune health, which can help prevent and manage sinusitis and sinus infection. Finally, remember to consult a doctor if your symptoms persist or worsen. It's crucial to get a proper diagnosis and treatment plan to manage your condition effectively. Ensuring that your sinus is healthy can not only help you recover faster, but also prevent future bouts of sinusitis and sinus infection. Thank you for joining us.